Child and Youth Services provides special needs accommodation. Their mission is to support military readiness. Also, a part of their mission is to accommodate children with special needs. CYS has a process to evaluate special needs placement, to determine reasonable accommodations, and the availability of services for children and youth that have special needs. When a reasonable accommodation cannot be met, the CYS chief will elevate that concern to headquarters MCOM G9. Children cannot be denied care at the installation level for special needs related reasons. After a parent or guardian completes registration paperwork with CYS, the child may be referred to attend a Multi-Disciplinary Inclusion Action Team, the MIAT. The MIAT has 4 components or core members, which are the Family, Exceptional Family Member Program, Army Public Health Nurse, and Child and Youth Services. The MIAT meeting helps gather information from the parent in regards to the child's special needs. Also in attendance at a MIAT meeting may be the center director or trainer. After a MIAT meeting concludes, tool number 2 is completed and scanned into CYMS for review. The tool number 2, in addition to any supporting documentation such as the IFSP or an IEP, is placed in the child's folder in the CYS facility. CYS utilizes the MIAT process to determine special needs placement and accommodations within CYS facility. Also, the MIAT is responsible for exploring options for children and youth with medical diagnoses that reflect life-threatening conditions, functional limitations, and diagnosed behavioral psychological conditions. Most MIAT meetings occur prior to a child being placed into a CYS setting. For those that want to be placed on the waiting list for CYS services, they may visit militarychildcare.com. The MIAT process is a collaborative meeting between both parent and CYS staff. The start date may be delayed for a child in a classroom if CYS staff requires additional training per what was written in the MIAT minutes. Trainings will be coordinated with the CYS trainer, Army Public Health Nurse, CYS nurse, and the Special Needs Program Manager. CYS is mandated to provide reasonable accommodations when available for children that have special needs. A reasonable accommodation allows for the child with a special need to have the same access and use and enjoyment of a CYS setting as a child that does not have a special need. Accommodations cannot change the fundamentals of the program. Any accommodation that makes a fundamental change creates an undue hardship to CYS. CYS also utilizes the Kids Included Together, which provides on-site visits, online learning center, and inclusion support center. CYS utilizes the operational guidance for behavior support. This guidance helps address behavioral concerns and unsafe behavior. It supports children and families, protects program staff, and decreases liability. It is a tool for behavior support process and working with parents. CYS utilizes the Army Behavioral Guidance Policy. This is mandatory guidance for managing classroom behaviors, and it is broken down by management, trainer, and CYPA roles. It focuses on 3 types of basic behaviors, which are challenging but developmentally appropriate behavior, concerning behavior, and unsafe behavior. It also talks about safety first for CYS staff and with how they can respond to unsafe behaviors and also de-escalate concerning behavior. Attempting to change a child's behavior with physical force is prohibited. For additional information on CYS services, please refer to the information listed.